Management of vertical malocclusion. Deep bite. Overbite represents the vertical overlap of the incisor, which represents the vertical distance from the incisal edge of the mandibular incisor to the incisal edge of the maxillary incisors when the incisors or the mandible eccentric occlusion, and it's normally is about 1 to 2 millimeter when the incisal edge of the mandibular incisors are contact the lingual surface of the upper incisor at the level of the cingulum. When this distance is 2 millimeter, it means an excessive overbite or called the deep bite. The deep bite can affect on the facial aesthetic, or the excessive overbite could cause destruction to the periodontium and wear of the mandibular incisor. The destruction of the periodontium and the wearing of the incisor could cause an impairment of the dental health and effect on the health of the temporomandibular joint and cause spacing of the maxillary incisors. The deep bite can be classified according to its origin to skeletal and dental deep bite. The dental deep bite is caused either by premature loss of the posterior teeth, and the premature loss of the posterior teeth could cause a lingual tipping of the anterior teeth. The lingual tipping could cause the deepening of the bite, in addition to the mesially tipping of the posterior teeth anteriorly, and could cause deepening of the bite or aggressive or excessive curve of speech. The dental deep bite also caused by supraocclusion or extrusion of the anterior teeth and dental deep bite. The dental deep bite could be caused due to the large sized teeth, where the large sized teeth on small arch or large sized teeth on normal arch could cause either proclination of the anterior teeth or crowding of the anterior teeth. The crowding and proclination of the anterior teeth could cause excessive overbite or dental deep bite. The skeletal deep bite caused either due to decrease in the anterior facial height or the anterior total facial height here, or long posterior facial height, and the long posterior facial height either due to the long ramus or the rotation of the condylar head, and this rotation causes anti-clockwise rotation of the mandible and deepening of the bite, and this deepening of the bite regarded as a skeletal deep bite. In addition, the skeletal deep bite either due to the horizontal growth pattern of the jaw, as in this case, or convergence or anti-clockwise rotation of the mandible and cause bite deepening, as in cases of class 2 div 2 malocclusion. The treatment mechanic of the deep bite, whether it is skeletal or dental, either by true intrusion of the anterior teeth or absolute intrusion of the anterior teeth, and the true intrusion or absolute intrusion of the anterior teeth done either by persistent intrusion arch, as in this case fixed appliance, or by utility arch, as in the intrusion of the mandibular teeth as in this case. The second mechanic for the correction of the deep bite by extrusion of the posterior teeth, or what is called relative intrusion. It's not true intrusion of the anterior teeth, but it is an extrusion of the posterior teeth, and this done either by functional appliances or by reverse curve of SB, as in the extrusion of the posterior teeth by this wire, which is called the reverse curve of SB, that cause extrusion of the posterior teeth and relative intrusion of the anterior teeth, or the intrusion of the anterior teeth is relative to the extrusion of the posterior teeth. The third mechanic of the correction of the deep bite is by extrusion or true extrusion of the posterior teeth, either by the cervical full headgear or anterior bite plane, and in this case we need for growth of the mandible to correct the deep bite, as in this case, which include the use of the cervical full headgear, which cause extrusion of the maxillary molar to opening the bite anteriorly, or using of anterior bite plane, as in this removable orthodontic appliance, which include the uses of the anterior bite plane lingually to opening the bite posteriorly and allow a space for extrusion of the molars. The retention of the deep bite cases after correction include the use of the Hawley retainers with lingual anterior bite plane lingually to the anterior teeth without the separation of the posterior teeth to maintain or retain the result after the correction of the bite correction.